School districts here in Western Mass are choosing remote learning for the fall. A new report has found an increase in the number of COVID-19 cases all across the U.S. among children. Western Mass News reporter Alyssa McCann spoke to a local pediatrician that is, to find out how kids in our area are faring.
New analysis by the American Academy of Pediatrics and Children's Hospital Association finds a 90% increase in the number of child COVID-19 cases from July 9th to August 6th across the country. And here in Massachusetts, the research shows as of August 6th, the cumulative number of child COVID-19 cases in kids ranging from 0 to 19 is 7,500.
I think right now it's way underreported because there's kids out there with COVID-19 that we're not testing and we don't know about it.
Dr. John Kelly from Redwood Pediatrics in East Longmeadow tells Western Mass News he has seen a handful of COVID-19 cases at his practice.
I haven't done a lot. I've done some testing, had a couple positives, but not a lot. I haven't seen anyone personally that is really young. No, I mean young by, under age 10.
But Dr. Kelly says that doesn't mean young children can't contract the virus.
Not that it doesn't exist. So, there's a lot of studies out there that are saying that, kids over age 10, we feel can transmit the virus as readily as an adult. The problem is we don't really know the kids under age 10. There aren't a lot of studies out there for those children because they've been home since March.
Dr. Kelly adds that here in the Pioneer Valley, there haven't been many tests for children because of a shortage of a substance needed to conduct the test.
The ones I have done for testing, if I have a known contact, like the mom is COVID positive, I'll send them for testing. But we really haven't had the carte blanche to go ahead and test these kids in mass because we haven't. There's a definite shortage of reagent. The lab has the ability to run more tests, but they can't run more tests because they don't have the reagent. And when I say lab, I'm referring to Bay State Reference Lab, which is the primary lab that we use here in the Pioneer Valley.
As daycares and some schools open up, pediatricians expect to see an increase in cases and even tests.
You can have more cases because you're doing more testing, but if the positivity rate goes up in a community, so right now in Massachusetts, we're, 1 to 2%. If we start seeing a 4 to 5% positivity rate, then we know there's more disease out in the community.
For Western Mass News, I'm Alyssa McCann.
Western Mass News is your school authority. You have questions or concerns as schools prepare to open back up or your child is getting ready to learn remotely. We're getting answers for you. You can call us with those questions at 413-846-0200 or you can email us at schoolauthority@westernmassnews.com.